Is not to make billions in profit for the insurance companies and the drug companies. The function of a rational healthcare system is to provide quality care for all in a cost-effective way, and that's what a Medicare For All program does. 50 miles away from the Canadian border, you're even closer to the Canadian border here. If Canada can have a Medicare For All single-payer system for decades, if the United Kingdom can have a national health service, if Germany has their programs, Scandinavia has their programs, if every other major country guarantees health care to every man, woman, and child in their nations, by God, we can do it in the United States.
Single-payer Medicare for All. What is it? Is it a government takeover of all healthcare? Will it cost more than a free market system? How do we even know it'll work? Okay, so we have to start off by saying that the basic multi-payer private insurance system is highly flawed and extremely inefficient. For example, in the US, people are limited in health insurance choices. Plans often constrict you to a small number of in-network doctors or hospitals. On top of that, insurance companies subsist on ever-increasing profits. In order to maximize and increase quarterly, they need an ongoing ability to create new money. Now, initially, this came from acquiring new clients, but they've reached the limit of candidates who can make them money without making claims on a regular basis. Now they're stuck with people who are sick, people who are going to need the doctor, people who are going to go to the hospital and get surgery. So how do you increase your profits while dealing with clients that are going to be more of a burden on your bottom line than other clients? So they've started insuring these people anyway, and then denying them whenever they need a procedure or a treatment of any serious cost. They often do this by finding a loophole and dropping coverage once a claim is filed. This is what the pre-existing conditions were all about. They would claim that a particular issue was linked to something that the client should have known about before, or that they could prove or somewhat tangentially link to the issue. So let's say you got skin cancer, but you had acne as a teen. They could claim that that acne somehow was indicative of the fact that you were prone to having skin cancer, and that because of that, it was a pre-existing condition, you violated the terms of your contract, and you are no longer covered. And so after you've gone and you've gotten surgery for your skin cancer, all of a sudden, your coverage is no longer there because they claim you violated the contract. Now, the Affordable Care Act, Obamacare, was supposed to fix this. They've delayed implementation of a lot of clauses of it indefinitely. Now, they've delayed that because the insurance industry lobby has pushed very hard and bribed very effectively to protect the profit margins from a law that might help the people. The Republicans like to fearmonger about death panels in America if we socialize health insurance. But let's be honest, we already have death panels. They're the private for-profit insurers. People who are sick cannot be treated if they cannot pay. The only exception is when they are about to die. It's a but-for legal test. If but for the withholding of treatment, the patient would have survived. The hospital is liable for treating the patient regardless of the ability to pay. So, basically, if you come into the ER and you are bleeding out and you won't survive without hospital treatment, they're required by law to treat you. So, what's the problem with this? That this is a way to make sure everyone gets covered, right, in the most extreme circumstances. Well, the problem is that after treatment, payment is still required The hospital is out money for the service that it's provided to you, the resources it's expended on you, and the time that the doctors and nurses have allotted to you that they could have been using to treat other patients. And these people have to be paid for that. They have to pay for the medications that have been dispersed. They have to pay for the team that's been assembled to, say, do a life-saving surgery. They have to pay for the room, the bed, the power, everything. So, what happens if the person cannot pay? Well, first off, they often have to deal with years of collections agencies and court orders, but the hospital needs to make that money back somehow. So how do they do that? Well, they do what all the right-wingers and conservatives claim that they oppose. They implement cost sharing. Yep, that's right. Even in a fully private system, you pay for everyone. They shunt the lost costs, the lost profit, across the board. So everything from syringes to aspirin to surgery to x-rays, any procedure, any service, any treatment that you can think of, prices go up. Costs for all those procedures and treatments increase for every single time this happens. That's why, say, an aspirin pill can cost, in different parts of the country, $7 a tablet, $15 a tablet, and even in some hospitals today, $22 for an aspirin tablet. These are actual numbers. These are actual prices that hospitals in the United States today charge for aspirin tablets because of this cost-sharing methodology. Now, the concept of preventative care is basically alien to the private insurance industry, and it's also alien to the American medical system. A poor person who doesn't qualify for Medicaid and who can't afford to both visit the doctor and feed their kids, and there's millions of these people, by the way, that they have to make decisions about necessary things all the time and prioritize. Well, if we don't eat for a week properly, if we just eat ramen instead of actual food that my children need to be healthy, maybe one of them can go to the doctor. Or maybe if, say, I don't gas up the car and I walk an hour and a half to work every single day for the next month, I can take my kid to the doctor. Decisions like that a lot of people who have money just simply don't understand. And so because of this, a lot of people will opt not to get treated for conditions when they're just beginning, which is, of course, preventative care. The only time they can get care is on their deathbed at a hospital's ER because of the law. Now, this means what could have been treated months or years earlier with, say, like an $80 doctor visit and a $10 antibiotic prescription or something like that, must later be dealt with utilizing things like life-saving measures, surgeries, specialist teams, and these things often cost tens of thousands of dollars, sometimes even hundreds of thousands of dollars in emergency care, especially if major surgery is involved. Now, this all leads to massive, like incredibly massive cost overruns. Bernie would say huge. That's a terrible imitation. I know I'm bad at them. But wait, it gets worse. Now, there are two major public insurance systems that are supposed to help cover the needy in the United States. However, neither of them works properly. Medicare works a little better, but it's still flawed. Medicaid is just a money pit. And this is why the U.S. government already spends more on health insurance per capita than any other country on earth, despite only covering about 1/3 of its people. That means, per person in the United States, more taxation, almost double the next country, in tax money is spent on public health insurance options. Yet, so few are covered, and the ones who are covered are only minimally covered. And with Medicaid, a lot of doctors won't even accept you. How can it get this bad? Americans pay so much in taxes towards healthcare, and most of us never see a dime in return for it. It's laughably ridiculous. Medicaid in many states only pays out 60% of service costs to providers. Now, there are some states that have increased those payouts to 100%. So there are some that give block grants to healthcare providers ahead of time in order to subsidize the lost revenue from taking on Medicaid patients. But yeah, a lot of states, only 60%. That means every single time a doctor or a hospital takes on a Medicaid patient, they're losing 40% off the top right away, and they know that. Okay, so Medicaid is a series of programs. There's 50 of them, and they're administered by the states, and then funding is matched by the feds. So I don't actually have the numbers in front of me, but let's just say one state puts in, let's say they put in $500 million into their Medicaid program per year. That means the federal government will then also put in $500 million into that state's Medicaid program. That's how that works. Of course, the state money has to come from state taxes, and the federal money comes from federal taxes. This is how the cost sharing is sort of balanced out between the two authorities. So, what happens when a Medicaid patient, is treated by a doctor or hospital, and that doctor or hospital is out that 40%? Well, by law, those healthcare providers are not allowed to pursue the patient or the government for that remaining 40% of cost. So they're stuck taking a 40% hit right off the top. What do? Well, it's the same thing that they have to do with non-paying patients. They take that 40% loss and they spread it out across the board. So prices on everything go up every single time a Medicaid patient is accepted. It's one of the reasons that so many doctors and hospitals refuse to take Medicaid patients, and why Medicaid patients who are supposed to be guaranteed care under this program often have to go incredible distances to find a healthcare provider that will actually see them. Now, these patients lose these healthcare providers' operating capital and profits. And they have to spread those costs across other services so the people who actually pay can cover those losses. In turn, the cost of Medicaid coverage and the tax burden to support it goes up. As prices across the board go up, Medicaid costs go up, taxes go up to provide those funds for Medicaid, and service gets worse because the doctors and hospitals are continuously looking for money that they can't get. This is seriously problematic. This is why I call it a money pit. It's cyclical. Medicare is a little better in that it doesn't actively contribute to the problem. However, in many cases it doesn't help either, and the fact that it's stratified and only covers a certain segment of the population is very problematic. So, Medicare, traditional Medicare, Parts A and B, are a social program. They cover the elderly who cannot afford to cover themselves. However, Parts C and D are more of a service than a social program. It's almost like the government acting as your agent or a negotiator on your behalf. So, the way the program works is that it covers the elderly who cannot afford to cover themselves. The federal government takes your payroll taxes, puts them into a pool, and negotiates with private insurers, like, say, Humana, for universal coverage plans. And that's what I mean when I say the government doesn't actually provide you your universal health insurance. They just use that enormous pool of money to negotiate a plan with a private insurer, so the private insurer is still there. Now, the power that the federal government has with this enormous pool of money allows them to negotiate a decent deal with these companies, when you as an individual going to one of these companies would have absolutely no bargaining power whatsoever. They'd give you 2 or 3 options and you would take whatever you could afford, or none of the above if you couldn't afford them. So, sort of like the ACA subsidization of private insurers, Medicare in a certain way is like a kickback program to private insurers. It keeps them in business and lets them take a little off the top. That's problematic. The feds could just pay the hospitals themselves, but instead, they're just paying their buddies, who lobby them in order to act as middlemen. All these insurers do is take the money from the federal government and redirect it to the hospitals and doctors. They're nothing but middlemen, and they take a significant chunk off of the top in order to provide that very basic, very simple service. It doesn't make the system worse per se, but it's silly, and it's a corrupt idea. It doesn't help to make anything better. That's a hard argument to sell to people because people love their Medicare. But that system would work a lot better if you cut out the private insurers and simply had the government take that pool of money and negotiate directly with the healthcare providers themselves and pay them themselves. It'd be a lot simpler, a lot more streamlined, and a lot more cost-effective. So, as the private and Medicaid insurance systems, coupled with these for-profit health insurance providers, drive costs through the roof, Medicare costs and the tax burden to fund it climb higher and higher simultaneously. So what I'm saying is, every time a non-paying patient gets treated, every time a Medicaid patient gets treated, and costs have to go up across the board for doctors and hospitals, prices go up on everything else in order to make up their losses, Medicare has to pay more and more out to cover these particular procedures, treatments, surgeries, whatever. And in order to fund those higher and higher payments, taxes have to increase and increase and increase. So this is what I mean by cyclical cost sharing. All of these things contribute to skyrocketing costs of health provision, skyrocketing taxes, and continually decreasing ability of the system to cope. It'll crash eventually. Or you'll get a really, really rapacious, unethical government, Paul Ryan, and they'll just repeal the laws that require providers to give service to the dying. You know, the people who aren't covered. That should save some money, if you're willing to sacrifice your soul and a whole lot of your countrymen for it.
In Congress, a small murder of GOP senators has been secretly writing a health care bill that would repeal and replace the Affordable Care Act, a piece of legislation that, while flawed, has saved the lives and improved the health of millions. The House version of the repeal bill would essentially give tax cuts to the wealthy and potentially cause 23 million people to lose their health care. Even President Trump... That can't be right. Of a country? Okay. Even President Trump has referred to the bill as mean. And so, behind closed doors, the murder of senators has been writing up a new, barely less mean bill and hasn't even let fellow Republicans see what's in it. By the time this comes out, there will be more information, but luckily we've acquired, breaking news, an anonymous letter from one of the senators crafting the bill. Dear America. Oh, that's nice. Yeah. I understand that people are confused and concerned about what the bill is going to look like, and I can tell you, please do not be concerned. I can't tell you about the bill, but I can tell you it'll be a bill. I mean, this is what we campaigned on. This is what we pushed for. Surely we have something in mind that won't just give tax cuts to the wealthy and make people lose their health care. That wouldn't be a very good health care bill, now would it? So you might be asking, why have we been hiding it then? Because why hide something you're proud of or something that's, you know, good? I mean, I could say this is payback for how the Democrats passed the Affordable Care Act. Goodness gracious knows that there are enough tweets from GOP members, including Vice President Mike Pence, condemning passing bills in secret, but also the ACA passage involved months full of 100 Senate hearings and 161 amendments from Republicans. And this has involved 0 of the first thing, but 0 of the second thing. So I guess maybe we're being secretive because it's still very bad, and son of a gun, I'm starting to realize that maybe we're bad. F***. What am I doing? What the hell am I doing? What is wrong with me? What is wrong with me? The tear stains make the rest hard to read. Can we get the rest of this transcribed for me? Thank you. Oh, good. What is wrong with me? What is wrong with me? I mean, sure, this new bill will kick fewer people from their health care than 23 million, but it will still be a lot of people. And we're cutting Medicaid expansion, especially if you're a pregnant woman, and I guess I just don't understand why it's so hard to get to a point where we can agree that if a government can, a government should take care of its citizens and help keep them alive. Almost every other developed nation in the world has some form of universal health care, so when people hear the idea and say, oh, you want a magical utopia where gumdrop kittens money? No, I'm talking about in Canada, most countries. Taxes pay for fire and police and defense and war and fighting terrorism because it's right there in the Declaration of Independence. We have the right to life, liberty, and the pursuit of happiness. The government should keep its citizens safe and alive. And as an anonymous senator who thinks maybe I've been doing a bad job, it doesn't feel like that's what we're doing, because you know what kills the most people? Diseases. Most of the things that kill people? Diseases. But we won't help because of some vague idea that people should pull themselves up by their own bootstraps, which is a phrase that was invented to point out how silly that idea is. You can't pull yourself up by your own bootstraps. It's impossible. Human beings didn't survive as a species because of survival of the fittest. We survived because we were collaborative and we help each other, and getting sick can ruin a person's life. So can dying. It takes away your liberty and your ability to pursue happiness. And as an anonymous senator who's starting to think that maybe I'm the bad guy, if we're not going to agree that a single-payer healthcare system is a good idea like every other developed nation, and also President Donald J. Trump in his book, The America We Deserve, then at least stop me and my colleagues from destroying people's lives for the purposes of enriching the already wealthy. There are already protests going on in and outside Mitch McConnell's office. You can see really fun footage of police dragging people out of their wheelchairs and away. So call your Republican senator. Hey, maybe it'll be me, an anonymous Republican senator, and tell them to oppose the bill. Call your Democratic senator and tell them to do everything they can to stop this bill from going through, including withholding consent and filibuster by amendment. Maybe it'll work, maybe it won't, but as an anonymous Republican senator who's just now realizing that, whoa, maybe I'm actually killing people, you have to try. And it sucks because the pharmaceutical industry and insurance companies are basically writing this bill, and they also basically wrote the ACA, and everyone is failing us, and they're all in the pocket of the fossil fuel industry or the pharmaceutical industry or some other people who I'm starting to think are also bad, like me, and it would be great if we were all in the pocket of, like, good stuff. Anyway, Medicare for All. Sincerely, Ted Cruz.
It's about efficiency of systems. That's what we're talking about here. The U.S. system is heading for collapse. It's costly, inefficient, ineffective, and does not hold the potential to last for a long time. The feedback cycle of non-paying, underpaying, and profit-seeking has led to continuous cyclical cost sharing, as I said before. This is a huge factor in the tax discrepancy between investment on the taxpayer's end and return for their investment. So what the taxpayers spend versus what they get for the money that they've spent. And this is a huge discrepancy that many people in the U.S. can't seem to fully understand. Here's the thing. Universal health care solves all of these problems, and all other developed countries have one form or another of a universal coverage system. Now, Bernie Sanders is promoting single payer. He calls it Medicare for All, but it's not really the same thing as Medicare. It's a single payer system where the government taxes you, takes that pool of money, and just pays the hospitals and doctors themselves. Much, much simpler, very streamlined. Now, if the Democrats do it themselves, it'll likely take the form of a singular federal program. That's how they like to do things, top down. However, if the Republicans have any input, and I'm sure they will, it'll likely end up something more like this. The feds create a basic framework, like an umbrella, and then they delegate administration of systems down to the states, of insurance systems. Every state will use taxation to provide full universal coverage to every citizen in their state. The feds can, say, match the funding from every state, alleviating half of the burden. Sort of like what they do with Medicaid in terms of they're sharing the cost between the federal government and the state government. Now, we could choose to cover permanent residents, visa holders, and other folks in the future if we find it feasible. But instead, you could require these people to purchase insurance from the state program. They could buy into the state program on top of whatever they're paying. Or you could do something like, say, create a small market for private insurers to cover these people. And they could buy into private programs for insurance. That way you could allow the private insurers to survive, even with a single-payer system. Now, the state insurance program would take no profit. The only money they would take beyond what goes directly to the healthcare providers would be what is required to run the program. So, operating costs, paying their employees, buying the computers and database systems to make sure all the numbers match up, things like that, and to perform oversight of payments to make sure nobody is crooked. So, everything else other than that operating cost would go straight from the program to the healthcare provider, to the hospital, to the doctor, to the clinic. No more middlemen, no more skimming off the top, no more quarterly profit growth, no more multi-payer and multi-processor fees, no fat CEO bonuses, no fat executive board bonuses, just straight 100% payment to providers. This system would stabilize the business of the providers, of hospitals, of doctors, of clinics. It would allow them to not have to spend years fighting to recover lost costs. It would bring down costs across the board after a few years of operation, piece by piece. This is, of course, after the backlog of sick and injured people who are unable to get care now, get processed through the system, get treatment. That would be the costly hump that we would have to get over. Once we've cleared that backlog of sick people, costs will come down. A system like this creates a safety net that prevents families from going bankrupt, prevents the poor from suffering, and prevents them from having to choose between necessities and, say, being alive or keeping their kid in good health. Ultimately, this type of system saves the taxpayer money. I know that sounds crazy, but it's absolutely true, and it has worked in every country that has ever done it. We have a lot of proof. We have a lot of case studies to choose from, and we have a lot of evidence. When the people save money in taxes, when they save money not having to pay private premiums or pay out of pocket for basic medical expenses, that allows them to keep more of their own money. They have more of their disposable income to bolster the economy. They can go and buy things that they want. They can go and make their lives a little bit shinier. It's a boon to the country all around. And as for you and I, all we will have to do when we go to the hospital or any other provider, anywhere in the country, you take out your state health insurance card, you swipe it, and you're done. No copays, no deductibles, no private premiums, no networks. Just solid, developed nation level healthcare. It works. It works everywhere that it has been tried intelligently, and we can do it even better than other countries have, if we put our minds to it.
You know how Nigerian princes send out emails to people who are easily scammed? That's the same people who like single-payer healthcare.
Actually, single-payer healthcare systems across the developed world, every single one is less expensive than the multi-payer fragmented system that currently exists in the United States. That's just a verifiable empirical fact.
Evan, you call the idea of single-payer insanity. Walk us through why it's so dumb.
They think it sounds great. It's going to be
The
perfect.
Democrats, in other words. Is that what you're saying?
The far left. I've actually spoken to one or two Democratic doctors who are rational and understand single-payer is a disaster. Every study shows that they would need to raise taxes and raise them double digits.
Well,
why don't we just give them all income?
Well, why don't we just all move to France? Anyway.
Well, the food would
Evan,
be better.
The food would be better. Look.
Well, Evan, I think we can all agree that the food in France is better. But that's probably where the agreement stops. When we talk about tax rates in a variety of countries versus the United States, I do think it's important for people to remember that, for example, although it's true that Canadians pay slightly higher tax rates depending on the income bracket as compared to the U.S., we don't have to pay for private health insurance.
You'd have taxpayers effectively on the hook for all these escalating medical prices and costs. Any Econ 101 textbook will tell you this. Without any kind of competition in the marketplace, if the government's footing the bill for everything, yeah, prices are going to go up.
It's important that people do the math in its entirety and understand that sometimes you only have to pay a little bit more publicly in order to pay much less privately.
Forgetting the idea that it's okay to try and help people, it's a fiscal nightmare.
That's certainly the choice that we've made in Canada, and it's working for us because we're providing health care to every citizen of the country without co-payments, without deductibles, care of very high quality at 2/3 the cost of the U.S. system.
Are you worried that this has any legs at all, though?
I think it does.
If you enjoyed this production by The State of Opportunity, please like and subscribe. Remember, you're the ones who make this all possible. You can also check out our Facebook page at Opportunity State and follow us on Twitter at @OfByOpportunity. If you feel like chipping in a couple bucks, please visit our Patreon page at patreon.com/stateofopportunity. Have a great day, and remember to always keep an open mind.